There are calls for mental health initiatives in Victoria to include targeted multicultural support, with fears many are still not accessing mainstream services. A further $60 million has been earmarked for hospital and outreach programs, but those working with African Australian communities say families are suffering in silence.
A professional counsellor and father of four, Santino Atem Deng knows firsthand the stress of a stage 4 lockdown.
Those who are really kind of struggling are those whom the language is the major barrier.
Social isolation having particular consequences for newly established African communities.
We came from a very collectivist culture, and this collectivist culture is where you draw support from one another.
He volunteers for the African Australian Family and Parenting Support Service, giving help to those struggling under COVID restrictions. Currently, almost 400 families have reached out.
We know that a lot of our communities have been excluded from the JobKeeper and JobSeeker, and there is no job out there for a lot of people who have work rights. So there is a lot of anxiety and stress for migrant communities at the moment.
Mental health hotlines across the country reporting major increases, with Lifeline showing a 25% jump in calls from last year's figures. In Victoria, self-harm emergency department presentations have increased over 9% for all ages and 33% for children and youth.
Mental health is an added layer and it's having a massive, huge impact in our communities. It's just we don't speak about it.
Youth mental health providers say experiences of trauma, stress and isolation have made African migrants more vulnerable. Ahmed Hassan says increased pressure around education and employment means many people can't see the light at the end of the COVID tunnel.
And many young people are very worried and concerned what the future of their livelihood would be like. What's the future of education going to be?
The state government has added almost $60 million in new money for mental health, funding more beds in public hospitals, community clinics, after-hours psychiatry services, outreach programs and supporting those who've attempted suicide. Mental health providers are calling for some of that money to be funneled into culturally appropriate support. Translation services are available for most of the mainstream providers, but they say help needs to be tailored to a community.
These communities are very resourceful. Often they develop their own solutions to these challenges and difficulties. So we need to work alongside the communities.
Santino Atem Deng says the key message, "We are all in this together," needs to be told, not translated.
But sometimes kind of verbalizing it is really more powerful.
Supporting mental health across the cultural divide. Abby Dinham, SBS World News.